I wake up every minute with the fever dreams. I push my mind to a limit where it needs to be. I work blind, got vision I don't need to see. I'm picking mind over matter, I believe in me. I need to find more hours in the day to breathe. Need to find more power in the way I be. And when my mind turns sour with the painful scenes, I need to scream out loud.
I'm back. I haven't like actually vlogged, made a video, but I've been putting up shorts. If you see me on TikTok, I am there. And today we're gonna do my skincare routine. Made my iced coffee, and let's just talk about things that you will like just realize after you have graduated nursing school, you passed your NCLEX, you're working on the floor, you're like, aha. So these are for my new grad nurses, my nurse girlies and boys who have been out there for like a year or so. You're like, if you haven't realized the things that you've like fully come into, like, so this is it. This is the list. If you haven't already, go ahead and comment, like, and subscribe. Don't forget to follow me on any of the platforms like TikTok and Instagram. And we can be best friends there, just passing on confidence and just sharing experiences with each other, because I don't know, you know what I mean? There's positivity. Like, why else? Why would you not? Is basically the answer. Why would you not? Anyway, let's just jump right into it. I've already washed my face. I am a dermatological girly. So I use their, I guess their clearing wash. So that's already done. And it did take me a while to make my coffee, so like my face is dry right now. Number one thing that you will know or realize once you've like actually hit the floor, that most of your practical things that you've either done like in sim lab, read about, just observed in clinicals, or maybe even had a chance to do like one or twice hands-on, you're practically probably going to like gain your expertise, knowledge, and sometimes even just learn those practical skills on the floor. So I'm gonna go in this with this Miracle Mist here just to rehydrate the face. Second thing is, even though there are nurse bullies, you will find a group that is about positivity, that you're gonna bond with, that you're going to just share, you know, your struggles, your triumphs with, and that bond will be like no other. Trust and believe. I am going to do my Neutrogena. This is my eye cream. And I get it, most people don't believe in eye cream, but like, I do. I believe in eye cream. This is the Hydra Boost eye cream. It has hyaluronic acid inside of it. Okay. As a nurse, I get it. We're all taught that nurses are caring. They're nice. They're whatever, you know, towards the patient. But towards the patient, sometimes you have to be the bad guy. And that's not meaning like the bad guy, like, oh, ignore them or whatnot. Being the bad guy is almost like if you are a parent, or if you know exactly how your mom treats you when you don't want to do something and she's telling you to do something for your good. That is the bad guy that I'm talking about. It's called tough love. You know what I mean? If the patient needs to get up and walk and they're like, no, I don't want to get up and walk, you know, I just don't want to, whatever, because even though healthcare is like a consumer type situation, because the administrators make it as such, this is ultimately the person's health. So there is a treatment plan, and sometimes a treatment plan can't be derailed because you don't feel like it. You know, you have to do at least attempt some part of it, and that requires me to be, not to take, sometimes take your no, just no at face value. I have to go ahead and explain to you exactly the reason why, and I have to go in there and not sometimes give you the option to say no. You know what I mean? I have to go in there as though you're going to give me a yes, and we're going to go ahead and we're going to do this. Hey Bob, we're going for a walk this afternoon. You know what I mean? I'm going to pre-medicate you at whatever time, and then we're going to get our stuff together, and we're going to do, I don't know, 3 doors down and then back, and then we'll sit in the chair for lunch. Something of that matter. Like, you gotta, because up to some patients, they'll tell you no for everything. They'll say no for everything, and then you'll have family members come in and be upset that, you know, my dad was able to walk, he had fully function and whatnot. And sometimes you have to be the bad guy. So be ready for family and friends, your family and friends, to not just get the stress that you're getting. They're like, you work 3 days. God forbid if you're per diem, even less probably. And they were like, what are you stressed about? And if you have not already gotten a hint of that, like being in nursing school, you will find out once you become a nurse, like fully on the floor in it. Next one is also Neutrogena. This is the niacinamide serum. If you are not sure about something, right? Second guessing yourself, you're like, was it 1? Was it 2? Was I supposed to whatever? Ask the question. Ask the question. I promise you, whoever's in like over you or working with you, charge nurse, fellow other nurse, like, they'd appreciate it because they don't mind giving you stuff, because they know that you're not gonna go ahead and like Wild West it and try and do it yourself, because they know if they can trust that if you don't quite know what you're doing or question what you're doing, that you're gonna ask or at least look for a resource to verify the procedure in which you have to do for whatever. Because nothing's more scarier than a nurse who's too scared to ask the question, to say, I don't know how to do it, or that's beyond my scope, or I've never learned that, or I feel uncomfortable doing it. That is the scariest nurse. Promise you. Not the nurse, not the new grad nurse. It is the nurse who's too afraid to say they don't know how to do it. That is the nurse you need to be scared of, to be honest with you. Next thing I learned is that there will be bad shifts, without a doubt. There will be bad shifts, but there'll be profound shifts where you're like, this is why I became a nurse, or this is why nursing is so cool. By the Creme Shop, this is their a vitamin C, like, I don't know, face balm. One thing's for sure, without a doubt, you will work short staff. You will work short staff. And that's 100% for my bedside nurses. I can't speak for like outpatient nurses or nurses who work in doctor's office. But bedside, yeah. Working short staff is not an uncommon occurrence. It's not like a rarity. It's not like a once in a blue moon. Remember last month when we worked short staff that one shift? Like, no, it doesn't. Like, that doesn't occur. Like, it's the majority, always the constant, and the rarity is now, boy, remember when we had all those nurses? that's, I mean, it's sad, but like now it's the full on reality. Whereas it was like a handful of time, now it's completely constant. Like, be prepared to become short staffed and surprised that you have enough staff. Caffeine is your friend as well as your enemy. Too much of a good thing is bad. Just remember that, okay? You have to know how to somehow cut your caffeine, but have enough caffeine to function. I personally like to only have 1 cup on my off days, which is today, and those 2 to 3 cups that I normally consume at work, to keep it there, I try to even keep it down to 2 cups, like at the start of the shift and then the 3 a.m. or 3 p.m. hour, depending which shift I'm on. It takes about a year to fully feel like you're not an imposter in shrubs. You're not an idiot, you're just new. Basically, like, it takes a full year. So within that year, if you're like, oh my gosh, those other nurses are running around circles around me, they're completing tasks, they're doing their head to toe assessments faster, ma'am, you're not dumb, you're just new. And it takes about a full year to feel like, aha, I've got this. Straight up. Next is the Col du Lait. This is the firming lift cream. Is managing death of a patient, telling a family member, telling whatever. It never, ever gets easy. Never gets easy. Never gets easy. And you'll find out that even doctors will try to skirt around and try to pass it off to you to like talk to the patient's family members, friends, whomever, to say, hey, your loved one has passed. I'm there to comfort. My MD is there to announce. Like, it is hard all the way around. It doesn't matter what position you hold in the medical field. Death is not something that you can just word vomit. It doesn't happen. It's not easy. It doesn't get easy. And if you were a new grad through COVID, you will know that it really wasn't easy. And a lot of that MD needs to announce it turned into nurses being the ones telling family members that their loved ones have passed. And it became even more hard and just wow. It's just hard, okay? Like, I'm remembering me please. When they said I had PTSD, like, literally, I felt the emotion of my first one, and that was so, I mean, it ripped my heart out. It ripped it out. Please. That being said, remember to take care of yourself. I get it. Like, you want to be this person known as a caring person. This is why you became a nurse. Yada, yada, yada. You're nice. You would do for others and hope they would do for you. The golden rule, yada, yada, yada. But we live... Where do we live? We live here. We live in this world, okay? And sometimes you have to say no to self-preserve yourself. You have to take the time to get yourself checked out, because honestly, if you don't take care of yourself, how are you supposed to take care of others that you so want to do? You have to take that time for that mental break, for the physical break, for the emotional break, just so that you can carry on. Okay, and we're gonna end it with Dermalogica. This is my SPF. Has about 50 in it. And the last thing that I feel like every nurse is gonna like realize, aha, this is this is it, is being a patient advocate is not just like walking up to whomever and just saying, hey, I think that maybe we should revisit this, look at whatever, yada yada yada. It's going to involve some debates, some stubbornness, and like a lot of nerve. Okay, because if you think the doctor is just gonna take it and just be like, oh, I hear you, and it's a no, you're gonna get cussed out. Like, you're gonna see how many adults out there love to throw the F-bomb, love to throw their degree, their years of experience in your face, as to why, if you think it's going to be like a simple debate of, oh, I hear what you're saying and I get, yeah, yada yada, but this is why I'm saying no, like, it's not gonna be that polite. I wish it was. I wish it was. And you will find some that they will hear you and they'll be like, oh, yeah, I hear you, but I'm not gonna do that, you know, and leave it as such. No, it's going to be full cussing. They're gonna threaten to write you up and whatnot, and you're gonna have to not be scared to get written up in that instant. You're gonna have to be like, I just brought a situation to that person, and be able to articulate to whomever they feel like they can get you in trouble with because they hold a medical degree behind their name, or they're in like an official office position. And if you happen to get written up, you get written up. I mean, if you feel very strongly about what you're advocating for, you need to be ready to like go to bat and articulate and just like stand behind your position. Okay, that is the care for today. And those are all the things that I think you end up learning within your year, or at least a little bit more. Don't forget to comment, like, and subscribe. And follow me on TikTok and Instagram, and we can be best friends there. Because guess what? If no one has told you today, let me be the first to say it. You will, and you are a great nurse. See you next time. Bye.
I'm my own worst enemy.